Kenyatta National Hospital. We're still talking about the fight that the country has against the third killer in the country, which is cancer, according to the Ministry of Health Report 2020. Dr. NALIAKA, let's continue with this conversation. Now, how advanced is the cancer center at KNH? And I'm asking this question because we've been seeing a lot of Kenyans, like once they get cancer, the first place they seek for help is outside as opposed to be locally sourced.
So I would say, I think in the country,
yes,
and even in East and Central Africa, Kenyatta National Hospital has the best oncology services. It is a one-stop shop. Name it, if you want a specialized surgeon, you'll get there. If you want an oncologist, you'll get in Kenyatta. You want an oncology nurse, you'll get in Kenyatta. You have a dedicated center to cancer care, you'll find it at the Kenyatta National Hospital. So it has some of the best specialists in the country on cancer care.
Yes.
And then in terms of infrastructure, there are new, as I mentioned earlier, there's a new cancer center coming up. Specialized treatment equipments are available in the country. We are also a center where, like, we know that majority of the patients can be treated locally, but a few who need specialized treatment, like to go overseas, specialists at Kenyatta actually support the Ministry of Health in vetting who needs specialized care overseas. For example, if a patient needs bone marrow transplant, they will prepare the patient locally and then they can go for the bone marrow transplant. And through that vetting system, the National Hospital Insurance can support a patient who is going overseas for a treatment that is not available in the country. And they're paying in tunes of even 500,000 Kenya shillings just to support that patient to ensure that they get the best care possible.
Yes, pretty much. So are we saying then that for any other Kenyan who's going to get affected by cancer, there is no need of your first option being, let's get out of the country? That 90% of the patients, as you said, can get treated right here within the country.
Yeah, definitely. You need to consult the doctors.
Yes.
The number of cancer specialists is actually increasing and we are training more. And they will give you an honest opinion. If your cancer cannot be treated in locally, then you'll be advised on the referral. But majority of the cancer treatment, name it, surgery, can be done locally. Chemotherapy, we are doing it. Radiation therapy, we are doing it. And we have all these specialized equipment that can offer this kind of treatments. And even if one goes to India, I mean, every patient has a right to be treated wherever they want to be treated. So if you can afford, you want to go to India, it is your choice. You can go anywhere. But what we are saying is, you also have a choice to be treated locally, and we have expertise that can offer that service. And we also reassure those who have already gone out of the country for treatment that when they come back home, we are ready to continue taking care of them, because cancer is not a single injection and you are told you are okay, you go to India for 1 month and you have completed your treatment. It's a journey, and as a country and as the medical fraternity in Kenya, we are ready to work with them. They can initiate their treatment in India, come back home with their drugs, we can continue the treatment here, we can continue the follow-up. So not everyone should go to India for treatment.
Pretty much. Something that you mentioned when we want to break, that cancer treatment is now a global practice, in the sense of the kind of treatment that you're going to receive for your type of cancer is not going to be any different as opposed to receiving it here right here in the country or being outside there. Is that the case now?
Yes, definitely. I mean, most of our doctors are internationally trained.
Yes.
And also we follow what are called international guidelines on treatment of cancer. We are following the NCCN. NCCN is an American system. We are also following the ESMO, European Society of Medical Oncology. This is from Europe. So all these guidelines are being used to treat patients. And so the same way you'll be treated in India is similar to how you'll be treated in Kenya, America. So we also do multidisciplinary consultation so that we want to give you the best possible choice. And the patient and family are involved in this choice of care.
Pretty much. One of the challenges that the report also noted was impacting our fight against cancer was the, if I'd like to say, lack of progressive training in this particular area for cancer. As KNH, how are you approaching it? How are you training, one, your nurses and doctors and onboarding them onto the cancer center?
So we start with the curriculum.
Yes.
Our curriculum is international and it has been validated. For example, the radiation oncology training at University of Nairobi has been validated by the International Atomic Energy Agency to make sure it meets international standards. Medical oncology training has also been validated. The nursing oncology, all of them, the radiotherapy training, medical physicists, we are collaborating with various institutions, technical university to train medical physicists, the TUC, Jomo Kenyatta University to train oncology nurses.
Yes.
And clinicians. Nairobi University in training doctors and nurses. We are having a medical oncology training and radiation oncology training. KMTC is training clinical oncology and palliative care clinicians. These are clinical officers. And also the nurses are also being trained. So, and all these institutions are internationally recognized. In fact, when you get a degree at University of Nairobi, you can go practice. Many of them, you've heard of brain drain. Our nurses, where are they going? They're going to US,
outside, yes.
Europe. These are internationally recognized training and they are working. They can fit in that system very well. So it's just to reassure the general public that as a country, the quality of nurses and doctors that are in training, they meet international standards.
Yes.
And they are safe.
From where you're sitting as a head of department and you're looking at the capacity that you have at the cancer center now, how far are we from getting to 100%? Because that has always been the question, that if you're fighting the third killer in the country, then you have to work faster to improve your capacities. You can actually get to fight it properly. How far are we?
I think cancer fight is a global problem.
Yes.
Actually, it's not just unique to Kenya. Even developed countries are still struggling with the cancer menace. But as a hospital, the government has pumped in resources, millions of money to build infrastructure into training. So I cannot quantify what percentage, but I can say that there's a lot of progress in that space. And we are hoping that in the future will be, I think, the Center of Excellence, and already the construction of that Center of Excellence is already on phase 1. We are going to go up to like 10 floors. So we've already done like 2 floors of the same. So there are major, major, major strides. And I think everything that limits all these things is financial. But as our current government is committed to supporting the cancer services, and we are hoping for a brighter future for our patients.
Pretty much. As a doctor now, let me just tip out a little bit and post you some of the questions that we got around cancer. Number one, somebody was asking, do you think there's a lack in cancer prevention awareness within the country? And this is what they're saying, that the country has made proper advancements in other areas. Case in point, HIV, AIDS, malaria. There are also guys who are talking about cholera as well, and child mortality rates in the country. Mothers are also educated on how to take care of their infants. that they feel like there is a lack of stress in the cancer segment within the country. Is that a feeling that you may want to share with them?
Okay, I would not say there's lack of awareness and maybe focusing on the same
Yes.
by our government, but I can say that there are major developments that have been done in that space. And also during the just ended National Cancer Summit,
Yes.
there was a lot of lobbying to have more funding or more budget allocated to cancer services, be it from screening all the way to treatment and survivorship. Many Kenyans actually are aware about cancer, but they fear to go for screening. Yeah, because they think that if you are diagnosed with cancer, it's a death sentence. But I'm here to say that there are things the government can do for you, but there are other things that you, as a human being or as a Kenyan citizen, you should be proactive and do for yourself. Like if you take up a lifestyle of taking tobacco and alcohol excessively, you know you are already increasing your risk for cancer. If you don't exercise, you gain a lot of weight, it's a problem. Using a lot of fatty foods, refusing to go for either screening or to go for checkup if you have any symptoms that are bothering you and you are being treated, or just the fear of going for screening. It's a problem. So we are encouraging people to come out and go for checkup. You don't wait when you are sick to go for checkup. There's also a lot of push for the mothers or parents to take their children, the girls who are between 9 and 14 years, to get the HPV vaccine. This is an immunization that will prevent this girl child from getting cancer of the cervix when they grow older. Things like lifestyle, we're encouraging you to take, to avoid risky behavior, like having multiple sexual partners. You are at risk of getting HIV and also at risk of getting maybe cancer because of just poor immunity. You are at risk of getting STDs, and for women, multiple reinfection with the human papilloma virus can sometimes increase the chance of you getting cervical cancer. So there are many, many things that I'm not able to cover in this sitting.
Yes.
But as I say that as a country, there are various strides that are being made in terms of the same. We are also going out to educate community health workers on just going down into the community and talking in their language about the common cancers, what are the common signs to look out for, and all that will help us have a better healthy nation. And people who have cancer, we are telling them it's not a death sentence, because we have a lot of success stories, patients who've been treated, and they have been treated here in Kenya and even Kenyatta National Hospital, to be specific, and they're living many years, 10, 20, 30, and beyond, and they are saying, yes, there is hope.
There is hope.
And people should not fear.
Pretty much. I've got this one from a lady as well, who's asking, as a woman, what are the common cancers that I am predisposed to, and what do I need to do to protect myself?
So in Kenya, breast cancer is leading, followed by cervical cancer.
Yes.
And then esophageal cancer. So for breast, to be specific, how do you, maybe there are modifiable risk factors and others are not modifiable. So modifiable risk factors include maybe you getting your baby before you are 30 years old, age at first birth. If it's less than 30, the risk is lower. If you have your children, breastfeed them. It is protective to the mother. Also, having more children is safe to the mother. Avoid use of tobacco and alcohol.
Yes, when we say more, what number we look at? You know, girls nowadays just want to get 1 or 2 and done, especially at the time when we're talking about family planning.
Yeah. Okay, there's no, in the African setting, you can't quantify, but at least a good family. There's a time one doctor told me that at least 4.
Whoa,
you saw it's a fair number.
Yes.
Yeah, but you can get more, but you should have resources to take care
To
of
actually
those
take care of them,
children.
yes.
It's not just a matter of having them.
Yes.
And then the risk factors that you cannot modify include just the fact that you are a woman. As you grow older, those ones you can't do anything about, or if there's a genetic family history, that can predispose you to the same. And we say that if there's a strong family history, then you need to go for more regular screening. Don't just sit and wait. And in case something is picked, it can be picked up early and you just lead a normal life. When we move to cervical cancer, the risk factors include repeated human papilloma infection. So this it's like having multiple sexual partners, or your partner having multiple sexual partners, initiating sexual debut at a very young age. So you get more prolonged exposure to the human papilloma virus. Lack of going for screening. If you are above 25, you are sexually active, we encourage that you go for screening. And this screening is available in the counties for free. The government has put infrastructure to take care of that. And obviously immunizing the girl child against the human papilloma virus, and this will protect them.
Pretty much. All right. Lastly then, there's a question that is a direct question as well. How many times should I go for screening?
So it depends on what the doctor finds and what are your risk factors. Yeah, but I say that try to initiate even during your birthday the first screening. Then from there the doctor will tell you on the frequency.
Yes.
There are some who may go yearly, others you'll be told come after 3 to 5 years for another screening.
Yes.
Yeah.
So not essentially a timed period, isn't it? You have to listen to what
you
the
have
doctor
to listen to what the
telling you.
doctor says.
Pretty much.
Yeah.
Now, let's go back to KNH as well, because you're at the center then of fighting the cancer threat in the country. Could you paint for me a picture, Dr. Catherine? I know you've been there for some time as well as a HOD, and we hope you're going to be there in the next like 5 to 10 years, isn't it? But when you look at the advancements that you've seen during this period you've been there as a HOD, if you look 5 years forward, what do you think you will be as a hospital in terms of this cancer fight dialogue?
We are really pretty much at the table.
Yes.
On the high table, because we are building the Cancer Center of Excellence, which will be completed in the next 5 to 10 years.
Yes.
We are also saying we are the regional hub of training. Actually, Kenyatta Hospital has been nominated by the International Atomic Energy Agency as the regional training center. So we are training not only for Kenya, but for the region. And
for somebody who wants to understand what that means in terms of a hospital as well, what does that mean? What's the implication of that?
It means that we are on international standards.
Yes.
Yes, we can train specialists in oncology in all fields as a hospital, and we churn out very qualified clinicians.
Does that also mean more investment into the hospital?
Of course, there's a lot of also progress in investment.
Yes.
As I mentioned earlier, there's already phase 1 of the Cancer Center of Excellence is complete. So the government is pumping in more money to have this dream realized. We also have specialized equipment, specialized theaters, and this is all actually availing quality cancer care.
Yes.
And in policy making, we are in the forefront, just making policies that will support the whole country. So as Kenyatta, we are not just looking at Kenyatta. We want a healthy nation, and we are just the focal point of building this capacity to the counties in terms of supporting. KNH is a national teaching and referral hospital, but we are supporting the counties at the same time. Yeah.
Pretty much. On that particular one, since you started working with the counties, have you observed anything that you may want to report in terms of how the counties are working with you in terms of this cancer fight?
We've got positive responses.
Yes.
In fact, the patients are now getting timely care. They don't have to travel all the way to Nairobi. Yeah, like Mombasa patients, you know, in the past patients had traveled all the way from Mombasa to Nairobi. But now that's a thing of the past.
Yes.
Nakuru as well, Garissa as well. So we've seen a lot of patients accessing care. In fact, in the past, patients around maybe 70% of the patients never used to arrive in Nairobi for treatment just because of those barriers. Money, where will I sleep? How will I get transport? How will I pay for treatment? But now majority are able to access in the comfort of their homes, and it's not that expensive. And those needing specialized treatment can still come to Kenyatta.
Pretty much. So the direct question again, I'd like for us to jump back and forth so we can actually get to cover this. We only have 3 minutes left. And this is somebody from Western Kenya who's asking this question. There was a story that was done in the media a couple of years back about how a specific type of cancer was affecting people from Western Kenya, and that was throat cancer. And they asked questions about whether hot tea, which is a synonymous culture in the western part of the country, could be linked to this particular cancer. Would you like to confirm that, or there is a twist to us understanding what throat cancer really is?
Yeah, I know, I'm aware there's actually a study which was done.
Yes.
And they showed that hot beverages, tea being one of them, can predispose one to esophageal cancer. So it is true, though we've not done really focused research in that region to establish if all those patients coming with throat cancer are taking the hot beverages. But cancer causation is a complex issue. Many people take the hot tea, but they don't get cancer. Yeah. So there's more to it than just hot tea. For example, genetic predisposition, a family history, use of tobacco, alcohol can also contribute. So all those things, and even when you look at maybe if you have a kitchen that's not well ventilated, you have a lot of that smoke in the house, it can also contribute. So I can say it's multifactorial. You cannot just say one factor, the hot tea alone, that there are multiple factors. And other times it's just bad luck that you get the cancer.
Oof, there's a lot to understand.
I know.
Yes.
And then majority of the cancers, really no one knows. It's not just in Kenya, even in America, they are still trying to research what exactly single thing that causes cancer. We know that there's genetic mutation, but there are many factors that come into play, both the known and the unknown.
And this is the other question again that I wanted to put to you as well, that some of the cancers that we know and the ones that we don't, as a department, in that particular research as well, are you also advancing in that section? Like researching into new forms of cancer that are not known yet?
Yeah, we are actually, with the training, with the University of Nairobi, the oncology training, then both nurses and doctors, one of the things that one should do is to do research. Research is our core business. We have a whole department dedicated to research, and there's a lot of research that is going on, and we hope in future we'll answer some of the many questions that you are asking today, but through evidence-based.
Through evidence-based.
Yeah.
Like, but of course, as you said, it's an ongoing research.
It is
never
ongoing.
Stop. You'll never say Kenya is now 100%
no,
in terms
of... it can never be 100%. Even America is never 100%.
It's never 100%.
They are researching. And they are, every day they are looking at modern ways of treating cancer.
Yes.
Yeah, even at Kenyatta, we are now not only using chemotherapy, we are using immunotherapy. These are new developments through research. We are doing targeted treatment, targeted therapy for cancer patients. So all those things, we also looking into it as a country, and always never stopping, trying to get the best answers possible. We are attending international conferences to see the new developments that are going on, and with that we are able to apply it also for our patients.
Pretty much. Clear picture. Dr. Catherine, thank you very much for coming by.
And thank you for
Now,
having me.
I hope we've answered all those questions for people who are asking as well, Kenech, it's not good for treatment. Guess what? She said the cancer center that is coming up is going to be the thing. It's going to be the focal point of really the fight against cancer. And she's saying we're making proper strides. In fact, the bigger takeaway today, if you went to cancer, if you went to Kenyatta National Hospital, you will not even get lost when it comes to even looking for where to go for help, should you think that you're a cancer patient in the country. That is the biggest takeaway. All right, take her back to the time that she came right here on Lookuptv, at Lookuptv, across all your social media platforms. I hope I've answered all your questions. I know there were many, but just put them together so we can actually get to compress them together to her. And if you have any other additional that we didn't get to put across to her, you do know what to do at Lookuptv across all your social media platforms. I am at Kiagasimba. We take a tiny breather. Once we come back, Ian Ketani and I will be taking you straight to what is trending this morning and the newsroom diary as well. Good morning.